Welcome to the Victory Education Lounge. I am your host, Maurice, and we're thrilled to have you join us for another exciting episode. Before we dive in, don't forget to like, subscribe, and leave a comment below sharing your thoughts or experiences. Your engagement helps us create more valuable content for you. Today we're exploring part 127 of our series, GLP-1 Agonists, a new frontier in insulin resistance treatment. These medications have been making waves in the diabetes and weight management communities, offering new hope for many individuals struggling with insulin resistance. Let's dive into the world of GLP-1 agonists and explore their potential in managing metabolic health. Have you ever wondered how GLP-1 agonists are revolutionizing the treatment of insulin resistance? Welcome to our series on this exciting topic. As we venture into the world of GLP-1 agonists, we'll shed light on how these innovative medications are changing the game when it comes to managing metabolic health. Firstly, a quick disclaimer. The information we'll be sharing is purely for entertainment and educational purposes. It's crucial to consult with a licensed physician before making any health-related decisions, especially those involving medications. So, what are GLP-1 agonists? GLP-1 or glucagon-like peptide-1 agonists are a class of medications that mimic a naturally occurring hormone in our body. The primary role of these medications is to manage insulin resistance and type 2 diabetes. They work their magic in a few different ways. 1. They stimulate the release of insulin when blood sugar levels are high. 2. They reduce the secretion of glucagon, a hormone that raises blood sugar levels. 3. They slow down digestion, which can help with feeling full. And 4, they may even protect and regenerate insulin-producing cells. Sounds impressive, right? But it's not just about the theory. The real-world impact of GLP-1 agonists on individuals struggling with insulin resistance has been nothing short of remarkable. In the coming scenes, we'll delve into some specific examples of GLP-1 agonists, exploring their unique features, pros and cons, and the impact they've had in clinical trials. We'll cover medications such as Semaglutide, Liraglutide, Dulaglutide, Exenatide, Lixisenatide, Tirzepatide, and oral Semaglutide. Each of these medications has its unique strengths and potential side effects, and we'll be examining these in detail. So, sit tight as we embark on this enlightening journey through the world of GLP-1 agonists. Now that we know what GLP-1 agonists are and what they do, let's explore some examples and their unique features. First up on our list, we have Semaglutide and Liraglutide. Both are notable examples of GLP-1 agonists, a class of medications that mimic a natural hormone in your body to manage insulin resistance and type 2 diabetes. Starting with Semaglutide, which you might know by its brand names, Ozempic and Wegovy. This medication is administered as a once-weekly injection, making it a convenient choice for many individuals. A standout feature of Semaglutide is its significant weight loss benefits. In clinical trials, it helped people lose an average of 15% of their body weight. A boon for sure, but it's also available in oral form known as Rybelsus. However, it's not all sunshine and roses. Semaglutide can cause nausea and other gastrointestinal side effects. It can also be quite expensive, especially if not covered by insurance. Switching gears to Liraglutide, marketed under the names Victoza and Saxenda. Unlike Semaglutide, Liraglutide is a daily injection. It's approved for use in children with type 2 diabetes, widening its reach significantly. Additionally, Liraglutide is also approved for weight loss. However, this medication requires more frequent injections than some other options and may increase the heart rate. But the proof of its effectiveness lies in the pudding. Liraglutide has been shown to reduce A1C levels by up to 1.8%, a significant achievement in managing blood sugar levels. In conclusion, both Semaglutide and Liraglutide offer unique benefits in the management of insulin resistance and type 2 diabetes. They illustrate the potential of GLP-1 agonists in revolutionizing the way we approach these conditions. However, like all medications, they come with their own set of considerations and potential side effects. Semaglutide and Liraglutide are just the beginning. Let's continue with more GLP-1 agonists. Next, we delve into Dulaglutide and Exenatide, starting off with Dulaglutide, which is better known by its brand name, Trulicity. This GLP-1 agonist offers the convenience of a once-weekly injection and comes with an easy-to-use auto-injector. One of the standout features of Dulaglutide is its cardiovascular benefits. However, it's important to note that it may cause thyroid C-cell tumors in animals, albeit the risk in humans remains unknown. Additionally, like many of its peers, it can cause gastrointestinal side effects. A prime example of its effectiveness is a demonstrated reduction in A1C levels by up to 1.5%. Moving on to Exenatide, you might recognize it under the brand names Byetta or Bydureon. This GLP-1 agonist is available in two formulations, a twice-daily injection for Byetta and a once-weekly injection for Bydureon. Exenatide is believed to improve beta cell function, which is a plus. However, the twice-daily injections required for Byetta may be a downside for some. Another potential concern is an increased risk of pancreatitis. Despite these caveats, Exenatide has proven its worth by leading to an average weight loss of between 2 and 4 kilograms over a 30-week period. As we discuss these medications, it's essential to remember that while they offer promising results, they are not a one-size-fits-all solution. The effectiveness of each GLP-1 agonist can vary greatly depending on individual factors such as your specific health condition, lifestyle, and even genetics. Therefore, it's imperative to have an open and honest discussion with your healthcare provider about the potential benefits and risks before starting any new medication regimen. It's also worth noting that the cost of these medications can be quite high, and not all insurance plans may cover them. However, many pharmaceutical companies offer patient assistance programs to help offset the cost. If you're considering a GLP-1 agonist for managing your diabetes or weight, it's worth exploring these options. We've now covered 4 GLP-1 agonists. Let's move on to the remaining 3. Lastly, let's explore Lixisenatide, Tirzepatide, and oral Semaglutide. Lixisenatide, marketed as Adlyxin, is a once-daily injection that is particularly effective at reducing post-meal glucose spikes. This can be a game-changer for individuals who struggle with sugar highs after meals. However, it may be less effective at reducing overall A1C levels compared to other GLP-1 agonists. And like many medications in this class, it can cause nausea and vomiting. In clinical trials, Lixisenatide has shown to reduce A1C levels by about 0.8%. Next up, we have Tirzepatide, also known as Mounjaro. This is a dual GIP and GLP-1 receptor agonist, which means it targets 2 different hormones that affect blood sugar. It offers significant A1C reduction and weight loss, and is administered through a once-weekly injection. However, as a newer medication, it has less long-term data available, and it can cause gastrointestinal side effects. In clinical trials, Tirzepatide helped people lose up to 22.5% of their body weight. Finally, let's look at oral Semaglutide, marketed as Rybelsus. This is the first oral GLP-1 agonist, which is a significant advancement for those who prefer not to use injections. It offers the benefits of Semaglutide, including weight loss and blood sugar control, without the need for a needle. However, like other GLP-1 agonists, it can cause gastrointestinal side effects, and it may not be as effective as injectable forms. These 3 medications, Lixisenatide, Tirzepatide, and oral Semaglutide, represent the ongoing innovation in the field of diabetes management. They each offer unique benefits that can make a significant difference in the lives of those living with type 2 diabetes. As always, it's important to discuss these options with your healthcare provider to determine which one is the best fit for you. Now that we've covered 7 examples of GLP-1 agonists, let's summarize what we've learned. The GLP-1 agonists are truly a new frontier in insulin resistance treatment. Over the course of this video, we've explored the revolutionary role these medications are playing in managing type 2 diabetes and insulin resistance. They're paving the way for a more personalized approach to treatment, offering new hope to individuals grappling with these conditions. We've delved into the mechanics of how GLP-1 agonists work, stimulating insulin release when blood sugar is high, reducing glucagon secretion, slowing down digestion, and potentially protecting and regenerating insulin-producing cells. It's this multifaceted approach that sets these medications apart, offering more comprehensive management of metabolic health. We've also discussed 7 examples of these life-changing medications: Semaglutide, Liraglutide, Dulaglutide, Exenatide, Lixisenatide, Tirzepatide, and oral semaglutide. Each one has its unique features, from administration frequency to specific benefits and potential side effects. It's evident that there's no one-size-fits-all solution here. The choice of medication will depend on individual patient needs, tolerability, and access. It's also crucial to remember that while these medications offer significant benefits, they are not without potential drawbacks. Side effects, such as nausea and other gastrointestinal issues, are common, and some drugs may have more serious risks. Therefore, it's essential to weigh the benefits against potential downsides in consultation with a healthcare provider. In closing, the advent of GLP-1 agonists marks a significant step forward in the management of insulin resistance and type 2 diabetes. These medications offer a more targeted approach to treatment, addressing several aspects of metabolic health simultaneously. However, as with all medications, they should be used judiciously and under the careful supervision of a healthcare provider. Remember, while GLP-1 agonists offer new hope for managing insulin resistance, always consult with your healthcare provider before making any changes to your medication regimen. Thank you for joining us, and we look forward to seeing you in our next video. In conclusion, GLP-1 agonists represent an exciting frontier in the treatment of insulin resistance and type 2 diabetes. By mimicking natural hormones in the body, these medications offer a unique approach to managing blood sugar levels and body weight. While they come with potential side effects and considerations, for many individuals, GLP-1 agonists have been game changers in their diabetes management journey. Thank you for joining us in the Victory Education Lounge. If you found this video helpful, please give it a thumbs up and share it with friends who might benefit. Don't forget to subscribe for more content on health, wellness, and personal development. Until next time, stay informed, stay healthy, and keep striving for victory in all aspects of your life. Disclaimer: the information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decision should be discussed with a licensed physician or qualified healthcare professional, especially if you have existing health conditions or are taking medications.